Hello wizards and welcome to part 2 of Unit 1 on Section 13 on Basic First Aid. Let's look at light or minor bleeding. With a small cut or a wound that is not bleeding much, there are two important steps for you to take. Wash the wound with water. Putting it under a running tap can be a good way of cleaning it, and cover the wound with a clean dressing. Bruises are caused by banging yourself against something or being hit by something like a ball, or being squeezed hard when someone pinches you hard, or you trap your finger in the pantry door when you're trying to shut it quickly. Small blood vessels in or just under the skin break so that some blood escapes from them. The blood vessels heal quickly so that you don't go on bleeding, but the blood that has already leaked out stays under the skin around the place that it hurts for a few days only. What happens? It feels painful, the bruised area swells up, your skin goes red and later black and blue then yellow after a few days, and you feel sore all around the area of the bruise. What you can do? As soon as you have hurt yourself, stop further bleeding and swelling or bruising by using RICE or RICE. R is for rest the injured parts, I means ice or cold pack on the bruise, 20 minutes on and 20 minutes off. Wrap the ice in a cloth rather than putting it straight onto your skin. Frozen peas in a plastic bag makes a good ice pack. C. Compression bandaging. Wrap a bandage firmly around the area, but not too tightly. If it feels hurt, it is too tight. E. Elevate the injured part, lift it higher. You may need to make a sling to support the injured part or find a cushion for a jumper to rest on it. If you or your friend is badly hurt, then you need to get help quickly. Send someone else for help, if possible, so that you can stay and comfort your friend while they're waiting. Burn. Scald burns from hot water and other liquids are the most common burns in early childhood. Because burns range from mild to life-threatening, some can be treated at home while others need emergency medical care. Immediately hold under cool running water or apply a cold, wet towel until the pain subsides. Cover any small blisters with a loose bandage or gauze and tape. Call an adult as soon as possible if it burns, and if it is on the face, hands, or genitals, or if they're larger than 2.5 centimeters anywhere on the body. Don't pop any blisters yourself. If the skin breaks, apply an antibiotic cream and cover the area with a bandage or gauze and tape until it's healed. Insect bites or sting. If the insect left a stinger, gently scrape the skin with your fingernail or a credit card to remove it without breaking it. If it affects your breathing, go to the doctor immediately. Sunburns can happen within 15 minutes of being in the sun, but the redness and discomfort may not be noticed for a few hours. This is painful and can be itchy with the skin looking red. You need to get out of the sun immediately. Take a cold shower or bath. Apply something really cold on the affected area. Drink lots of liquids in the next 2 days. And use moisturizing creams or aloe gel to provide comfort. When going outside, all sunburned areas should be fully covered to protect the skin from the sun until healed. Get emergency medical care if a sunburn causes blisters or is extremely painful. If you have facial swelling from a sunburn covers a large area. If you have a fever or chills after getting sunburned, have a headache, confusion, or feeling faintness, or if you have signs of dehydration, increased thirst, less pee, or dry eyes and mouth, this is preventable. Avoid too much exposure of the sun and wear protective clothing, sunglasses, and a hat. Apply sunscreen that provides UVB and UVA protection with a sun protection factor SPF of at least 30.